Welcome back to the show, Talk with Your Doc. With me is Dr. Marlon Hagerty today, and we are talking about radiation treatment. Dr. Hagerty, you mentioned about various types of radiations and how long it is to be taken. But can you please explain us the mechanism of the radiation?
Yeah, it's rather complicated, but to boil it down, basically, if we're using photons, which is the most common way to give radiation, the photons will interact with the tissue in the body. And what happens is it will damage DNA. So when we focus the radiation on the tumor, it will damage the DNA of the tumor cells. So next time the cancer cell wants to divide, what happens is that will fail and the cell will die. So if it's a tumor that's quickly dividing, then when we treat with radiation, we can see the tumor shrink down very quickly because the tumor cells don't take long to try to divide next. If it's a slowly growing tumor, then it may take a long time to see the effect of the radiation because it might take several weeks or even several months for that cancer cell to try to divide again.
So basically radiation does it causes death of these tumor cells and reduce the speed of the growth of the tumor. Is that right?
Yeah, so also it can affect the cells that might support a tumor. So if there are blood vessels that are coming in to feed the tumor, and we focus a lot of radiation on the tumor, not only are we killing the tumor cells, but the blood vessels may also be damaged, and that will help kill the tumor.
Now, can you please tell us about, sometimes I've seen patients receiving radioactive iodine as a systemic treatment, oral treatment. So how does that work?
Yeah, so for people with thyroid cancer, where surgery has not been able to get rid of everything, and there's still sign of active thyroid cancer, sometimes what we can do is treat with radioactive iodine, and that's because many thyroid cancers will still like to grab the iodine because that's the job of the regular thyroid gland. It likes to grab iodine out of the body, out of the blood, and use the iodine. And so when we treat a patient with radioactive iodine, that iodine will go to wherever the thyroid cancer might be. So if they've had cancer that's spread into the lungs, for example, the iodine would be taken up by the tumor cells in that lung, and then that would be able to kill the tumor cells there.
Right. Now, so how do you give this radioactive iodine?
That would either be with a drink or a pill.
Okay. And how long it's to be taken?
Well, it'd be a single dose.
Single dose.
Yeah, and then we'd watch them over several days as the iodine is slowly excreted from the body. So it would come out of your pee.
So now radiation treatment can be given by 3 ways. So you say a patient is in a room and they receive a radiation from outside, that is external beam radiation. Then there is a radiation where you inject the radiation within the organ, which is a brachytherapy. And third is this systemic treatment where patients are given either pill or substance to drink, and then the radioactive substance is being given. Now, what are the general side effects of the radiation treatment as such?
So if we look at the external beam radiation again, which is the most common way to give radiation, again, it really depends on where we focus it. One very common general side effect is tiredness.
Tiredness. Patient feels weak, very weak while
no, it's the body's natural response to radiation is tiredness, but usually what happens is if the patient is having radiation, so say they're going to have 5 weeks of radiation, their normal day would be quite typical for them, but they might want to go to bed an hour early or something like that. And that tiredness, if they do get it, it would typically wear off a few weeks afterwards.
So patients may not realize that they are taking any treatment, but there is a radiation coming on their body. But that itself can be tiring.
Yeah.
So just taking a rest, or is there any other treatment required for the radiation side effect like this, tiredness?
Well, yeah, there are many, many possible side effects. If you think wherever we focus the radiation, all of the healthy organs in that area have to be factored in by me. And so I know how much any part of the body can receive without being worried about the function of the organ. But when we go past that, then we have to worry about side effects. So if we're focusing on an area that needs to be treated that's very close to the surface of the skin, for example, then that could cause redness or itchiness on the skin, or even peeling and pain on the skin. So if we're treating in the area of the abdomen, that could cause nausea or changes in the bowels.
So these skin side effects or the boil side effects, are they temporary or permanent?
Sometimes it can be just a temporary thing.
So
but
it
again,
will go away after stopping the radiation treatment?
Yeah. So, but sometimes somebody can have redness or itchiness or peeling on their skin, which would be a temporary thing. But if we had to give a very large dose in that area, sometimes they could have thickening of the skin, or changes in the color of the skin, or even loss of hair in that area for the long term.
Which can be long term?
Yeah. So even if somebody has a big reaction during the radiation, it doesn't mean that they're going to have problems in the long term. The short term and the long term side effects can be very different.
So radiation is a life-saving treatment, even though there are some short-term and some long-term side effects.
Mm-hmm.
And radiation is probably one of the major treatment in the field of cancer.
Mm-hmm.
Is there any new advances in the cancer treatment or radiation treatment coming up?
Yeah, there's always lots of advances. Every year we see how we might be able to treat a cancer patient better using radiation. And so there's a lot of active research in this. So basically, almost any kind of cancer I can think of always will be having advances from one year to the next. So we're very encouraged about that, but it also means that we have to stay up to date on all of the advances, which can be a big challenge for any radiation oncologist.
Thank you, Dr. Hagerty, for coming and explaining us about the radiation. And I'm sure all the patients or all the viewers will get benefit out of it. Thank you so much.
You're very welcome.